As part of this initiative, World Food Programme in partnership with NaNA convened the inaugural meeting of the Coordinating Committee on the Field Nutrient Gap Analysis. The Field Nutrient Gap Analysis is a national process that integrates an analytical framework with stakeholder engagement to foster consensus and informed decision-making aimed at improving the nutritional quality of diets across the country. This analysis examines the availability, accessibility, and affordability of nutrient-rich foods required for adequate dietary intake. Mr. Malam Fofana, Acting Executive Director of NaNA, emphasized the significance of the field nutrient gap analysis in addressing the Gambia's ongoing struggle against food insecurity.
This particular study is trying to look at the nutrient gaps. We know food contains nutrients, and nutrients have different functions in the body. One of the functions of nutrients is to help us to grow and develop. It also helps us to protect us from disease and infections. But this comes from the food that we eat. And that is why usually we, the nutritionists, always said, you are what you eat. Because what you eat contains nutrients that have special function in your body. So if there are gaps in your nutrient intake, it affects your humanity. As simple as that. So this is a very important study to look at where are the gaps. And in those gaps, what are the contributing factors to those gaps?
Mr. Fofana highlighted that poverty remains one of the major contributors to the country's high levels of food insecurity.
Another contributing factor to food insecurity and nutrient intake is poverty, which is also high in this country. The Integrated Household Survey 2016 indicated that around 48.6% of the people are poor, households are poor. A follow-up survey in 2020 shows that this has risen to 53%, which also affects our purchasing power, our ability to provide nutritious foods that are of high quality based on our requirement. But we also, as a country, develop policies, guidelines, and strategies to address poverty, to address food insecurity, to address malnutrition in the country. But we still need to know where do we need to tweak our strategies? Where do we need to focus a bit? Do we need to change our approaches? And I believe this study will help us reveal some of those issues.
Meanwhile, Miranda Sende, World Food Programme country representative to the Gambia, pointed out that the nation continues to face substantial food insecurity, which she attributed to the rising cost of living.
As we know, the Gambia is still facing high food insecurity and malnutrition, and which is driven by many factors, which are also diverse, such as high food prices, for example, due to global supply chain disruptions, cereal production deficit in some regions, increase in the price of some commodities, including water, electricity, and climate disasters.
Sende also shared insights from World Food Programme's recent surveys on food security in the Gambia, underscoring key findings from these assessments.
We've done an analysis last year in 2023, which is called the Nutrition Food Security Survey. And it was led by the Gambian government, WFP. It showed that more than half the household in rural areas, and this represents 53% of the household, are experiencing food insecurity. 24% of these households have inadequate food consumptions. So you see, this issue is a very important issue in this country. In addition, We've done what we call a nutrition sentinel survey in 2023 as well, and it revealed the critical level of acute malnutrition, which you know as wasting, among children aged between 6 months and 59 months. This prevalence is at about 8.5%. And there's also chronic malnutrition, which you call stunting for the people that are aware of this jargon. And the prevalence for this one is 18.3% at national level, which is something very important that we should look at.
Field nutrient gap analysis will help the government, World Food Programme, and other stakeholders to identify context-appropriate interventions that can be implemented throughout the food system in different sectors. This includes the social protection, health, education, and private sector systems to provide people with better access to and affordability of the nutrients they need, which will enable and stimulate them to choose more nutritious food, hence filling the nutrient gaps. Reporting for Kerfatu, I am Landin